Good morning. Thank you for being here. It was a pleasure to be asked by our Dean, Paul Casella, to come and share with you a little bit about how best to support our college students with concussions and brain injuries as well. I'm really happy to be talking to you in March because March is nationally marked as Brain Injury Awareness Month, so this conversation couldn't be more timely, where I get to share with you a little bit, not just about how concussions affect our students, but also perhaps have you think a little bit about what you can do in your sphere of influence as educators when you're trying to support a college student with a brain injury or a concussion. So this graphic from the Brain Injury Association really highlights that brain injuries do not discriminate, and we know anyone from infants through to older adults can be affected by a concussion, which is a mild traumatic brain injury, but also more serious brain injuries. So let's get under the hood a little bit, as we often say in brain injury, and think about our brain at first. The brain is our human body's best protected organ. So when you try to visualize how the brain sits inside your skull, imagine a really thick, dense, bony scalp and skull under which there is a human brain that weighs about 3 pounds and is the texture of jello. It's tethered down by our meningeal layers, and it bounces around in cerebrospinal fluid so that there's all kinds of good shock absorption. So it's a wonder we still managed to hurt this guy, our brain, but it does happen. When you think about brain injuries, there are two types. One are the open head injuries, where it could be an example where the integrity of the skull has been damaged or shattered or fractured. And this typically results when someone's had a penetrating injury like a gunshot wound. Many of our veterans who are exposed to blast injuries also sometimes have open head injuries, which are much more serious. You can also have a closed head injury where the skull has remained intact, but the brain has still taken a hit or a bump or a jolt that can happen, from a motor vehicle accident, from a fall, from some type of blunt trauma to the head, and certainly from concussions. So if we were answering today the basic question about what is a concussion, it really is a legitimate mild traumatic brain injury. So that it is mild does not take away from the fact that there really has been some damage to the brain when someone experiences a concussion. The Centers for Disease Control report that we see anywhere from 1.6, 1.7 to upwards of 3.7, 3.8 million concussions every year in the United States. And once again, the point is that any of us could be in a situation where we are in a recreational event, a sporting event, even if we're not athletes, which I assume several of us are not, you can still be at risk for a concussion just because that can happen from any type of fall or hitting the head. So a concussion really causes the brain to move rapidly within this intact skull. So the skull is fine, there's no damage to it, but because the brain has bounced around, there can be shearing forces that stretch out your nerve tissue or twist it. And so because of this type of movement, which isn't typical for the brain, you can then experience a series of effects. So we know that our students and certainly if this happens to any of your staff members or colleagues, then it's good to know that a concussion really does have a whole range of effects, some of which are mental or cognitive effects, where the person really feels very tired, dazed and confused, is unable to attend to detailed things in conversations or in a meeting, or details that might be involved when you're trying to write a report. There are some well-known physical effects: headaches, nausea and vomiting, sometimes balance issues, blurred vision, all of which could affect our students. There are emotional consequences that happen, and this is largely just a result of the brain's taken a hit or a jolt, and it's going to take it some time to get back to where it needs to be. So it's important to know that most people typically do recover from a concussion. There's a couple of caveats, however. The recovery is dependent on the degree to which physical and cognitive rest is ensured in the few weeks after a concussion. The second thing is that it really is paramount that you don't somehow sustain a second concussion or another repeat concussion while still recovering from the first one. Last thing on this slide is that another reason why attention, memory, and those feelings of confusion persist after a concussion is that when you talk to clients that have experienced a concussion, they usually are not sleeping well. So there's been some alteration to sleep patterns where they're either not getting enough sleep or enough good quality sleep. So what are the characteristics of a college student who might have recently experienced a concussion? Dizziness, nausea, as I mentioned, frequent headaches, being very sensitive to distractors, light, sound. This can be a problem. As you know, our classrooms are very busy environments. You can also expect a student to be having real difficulty concentrating or remembering things. A student might often tell you that something just doesn't feel right. I feel like something's not fine with me. Or they report feeling really down is another descriptor that might be shared with you. So after a concussion or brain injury, this gets to that point that given those symptoms, time has to be allowed for the brain to recover and heal at this point. So this means this injury has to be rested. Physically, the person cannot return to sports or anything physically demanding unless they're cleared to do that by a physician. And cognitively, which we sometimes pay less attention to, but is very important, that the person is not back on their devices, they're not back in the classroom, because all of those are very cognitively demanding environments. It also means, no screen time, no television, no video games, no computers, and this is all in the interest of making sure that the person is in that category where most people, as I said, do recover from a concussion if things are done right in terms of securing physical and cognitive rest. And there's some other physiological factors such as getting a good night's sleep, hydrating, avoiding drugs and alcohol. So usually someone who's had a concussion is under a physician's care unless they are not aware that those mild symptoms they're seeing are actually a concussion that they may have experienced. So this is one reason I think raising awareness about concussions is so important, because the initial symptoms can be subtle, but if physical and cognitive rest is not assured, these can be more persistent. So what are some of the classroom challenges for someone that has had a concussion or a brain injury? I think that tops the list would be to remember that this person will have clear difficulties concentrating, especially for long periods of time. So the typical class that I teach is 2 hours and 50 minutes. And somebody who's had a concussion, let alone many of our typical neurotypicals, as we call them, also struggle with that length of time. So absolutely understand that this student, if they have reported to you that this has happened to them, is going to have great difficulty concentrating for that length of time. This is a student that's going to easily experience some sensory and physical overstimulation. So there will be difficulty with too many distracting activities in the classroom, difficulty with certain tasks that require you to listen and take notes, which in the clinical world we call a divided attention task, that you need your full capacities of attention to do something like that we take for granted in the everyday classroom. There's difficulty ignoring distracting conversations and noises from devices and everything like that in the classroom. You can expect difficulty with remembering scheduled appointments or due dates and so on. I found that some of my students that are recovering from this, even a few weeks out, when they've been cleared by a physician and have returned to the classroom, can still be very challenged if they're in a complex group project where there's lots of components to be managed, there's interactions with people and logistics on top of that. This can pose an additional challenge because the person is still not fully recovered from that initial episode of a concussion. Most certainly, taking an examination in regular or typical classroom environments can be very difficult. So we really have to think about some of the test-taking accommodations that might really benefit this person when they're first returning to the classroom after having healed from a concussion. So extended time to complete assignments and examinations is another request that you might receive or that you should consider even if a student hasn't quite requested it. Let's talk about some other types of educational accommodations for a college student with a brain injury or a concussion. And I really want to echo Elizabeth was making this point when I walked in, that we really are, if we go at this from a frame of universal design and inclusion, that certain teaching strategies, certain supports and resources really help everybody. I think that's a way to think about some of these accommodations, that most of our students would benefit from some of them. Now, specific to that student that you have that has had a concussion or a brain injury, I think what I want to say to educators and advisors and mentors of students, even supervisors of employees, when someone says to you that they've had a concussion, treat it as you would any other significant health condition. It is invisible. You don't necessarily see it. The Americans with Disabilities Act does not consider a concussion a disability because of its temporary nature. So we know if things are done right, people do recover from a concussion, except in rare instances where the effects linger for some time longer. If you feel that you don't know enough about this, I think over the course of my teaching career, it's been one of the best collaborations has been with Accessibility Services and the Accessible Education Center, because they really embrace that mission of being non-judgmental, but also very evidence-based and strategy-focused for what you can do to do your job well as an educator in a day-to-day situation. Be understanding of a student's need for absence from class, and this could be for a few weeks. So it's not for a couple of days. It could be really for a few weeks. And this is because there are restrictions on things like driving. If the person is dizzy or has ringing in their ears or blurred vision, as you might imagine, they really shouldn't be driving a vehicle. This poses a challenge then. How do you get to class if you don't have someone to drive you? So be understanding of that need for absence, and really a student shouldn't be back in the classroom until a physician has cleared them for what we call return to learn. So for our athletes, we have return to play recommendations, if this is a person who is an athlete, but we also have return to learn recommendations for folks that are not athletes. That doesn't mean that they can come back to their daily schedule immediately after having had a concussion. So you can ask about this too. Have you been cleared by a physician to return to class? I find that sometimes young students can get so anxious about how you perceive them because they're missing class or they're asking for more time on an assignment that they will sort of hurt themselves in this process and try to come back too quickly. So if you know more and know better, then you can lead that to say, I'm okay with it. I know that this happened to you, and I know that you may need a few weeks, so until your physician clears it, I'm okay with that. Be open to short-term measures, such as deferring test taking or critical assignments. And I think my view on this is just an investment in our students, that I really don't want to see a student rush back to class and then to take an assignment when they're not ready and to then have a hit on their grade that they live with forever. I'd really rather support them in being as healthy as possible, knowing that a concussion is a serious matter. I think providing some accommodations during a test, a quiet room, a break as needed, if the person needs water, food, and extended test time would really help the student. And some other helpful hints, also want to echo Laura Kassab was just talking about this, that using multimedia that's as accessible as possible. Students that I've worked with in the past, ranging from someone with a learning disability or a brain injury or a concussion, have really benefited when videos have captioning, or there are online recorded lectures, either through lecture capture, which I know is going away, or through just an animated PowerPoint that they can get alternate representations of some of the content that they're missing. If you can provide any extra support in terms of advanced access to instructional materials, office hour visits, sometimes it's easier to have that one-on-one conversation. If you have a student that would be willing to have their notes shared, sometimes that type of, trying to set up some type of peer-to-peer assistance in such circumstances can be very valuable, where a peer in the classroom is much more likely to respond to your suggestion, to say, would you mind sharing these notes or being a resource for your peer who is returning to class. Of course, you have to have permission for all of this type of conversation. Appreciate that a student recovering from a concussion might find it difficult to complete or participate in certain projects that might be complex or capstone-like projects, where you may want to consider if there's an alternate that you might implement for this student given their unique circumstances. If this is near the end of the semester, I would suggest that you have a conversation with the student about what might be involved in taking an incomplete. I have found in my career that students in a variety of difficult circumstances are very nervous about what it means to take an incomplete. And they're often not aware that it just means you complete the work later and get your grade later, and it does not have the same lasting bad influence that a bad grade has on your academic career or your transcript. So I do recommend that, especially when I know a student is struggling to try to keep up. That was it for my section, and I want to say, I think my final word would be that you keep the faith when someone tells you that they've had a concussion. In my experience, it is almost uncommon that someone would have randomly said that. People usually are really struggling when that happens, struggling to make sense of what's happened to them, and really looking for any support. So here's to us making college education a little more inclusive for someone that's had a concussion or a brain injury. Thank you so much.